I'm Dr. Kanika Sharma and Senior Consultant in the Department of Radiation Oncology at Dharamshila Narayana Superspeciality Hospital. Prostate cancer is on a rise in our country, and almost 28,000 new patients of prostate cancer are diagnosed in our country every year. The incidence of prostate cancer is 9 to 10 per 100,000 of our population. So it is important to know about prostate cancer. A lot of people don't know what is prostate gland. Prostate gland is a gland of our reproductive system which is located below the urinary bladder. So any time when the prostate gland increases in size, it causes problems in urination. So the symptoms of prostate cancers are primarily the urinary related symptoms like increased urge of passing urine, wanting to go to urine repeatedly at night, urine stream not falling on the pot, rather falling onto the feet, or urine getting stuck in between urination. Many times elderly gentlemen come with urine blockage into our emergencies when they have to be catheterized because of urinary blockage. If tumor spreads, then there may be blood in urine or in semen. There may be erectile dysfunctions, or sometimes there may be backache, pain in the legs and lower abdomen if the tumor has advanced. But fortunately, there are so many tests which can pick up prostate cancer very early, but people are not aware of them. But first we should define who are those people who should go for this test. So risk of prostate cancer is more in people who are more than 50 years of age, especially if they have prostate cancer history in their male relatives such as father or elder brother or younger brother. Those men who have a high BMI, that is truncal obesity, have sedentary lifestyles, are taking lot of processed food with lot of fats in their diet with less fiber, are predisposed to prostate cancer. There are many hormone related issues in the body which relate to the development of prostate cancers, and these hormones are related to our truncal obesity. So all the people who fall into these profiles should be more aware of their symptoms and can go for a screening for prostate cancer after 50 years of age. If somebody already has these symptoms, then he should reach to the healthcare facility to get oneself diagnosed, because many a times it may not be prostate cancer. Even the benign hypertrophy of prostate can cause these symptoms. So what are those tests which we can do to find out whether there is prostate cancer or not? These are very simple 3 tests. One is called PSA. It is a blood test in which the values are elevated if somebody is having prostate related conditions like prostatitis or malignancy. Second thing is digital rectal examination, where the doctor examines the prostate through the rectum to find out whether it has increased in size or it is irregular in shape and hard. The third test is biopsy, which confirms that prostate cancer is there or not. The treatment of prostate cancer is related to the risk stratification and stage. Most patients are treated either with radiation, surgery or hormonal therapy. Some patients may require chemo. In early stages, that is in low risk and intermediate risk, surgery or radiation offer equal chance of cure. The doctors will discuss pros and cons with you of either modality and will decide as per your body what suits you better. In advanced stages or in the higher risk categories, treatments tend to be multimodality. Majorly, radiation is used in 60 to 70% of these cases. Radiation is feared by a lot of patients and they have apprehensions related to it, but in current day, radiation is a very safe and an effective modality in treatment of prostate cancer. For prostate cancer, we treat by image guided radiation, where we identify the prostate gland and at the same time also monitor the location of the bladder and the rectum so that these 2 organs are not affected by the bad effects of radiation. So radiation becomes safer and more effective. Machines like Halcyon again are a boon for patients of prostate cancer, because when we treat prostate cancer, the patient has to be bladderful and has to be holding urine during the treatment. So if somebody has to hold urine for 30 to 40 minutes, it is very uncomfortable and tedious. But machines like Halcyon, where the entire treatment completes in 3 to 6 minutes, it is very comfortable to the patient, especially those patients who cannot hold urine. And so it becomes effective and safe, and long-term side effects are reduced. Thank you.